Good afternoon, Mercer Island community. My name is Jessi Bon, and I am the city manager of the City of Mercer Island. Thank you for tuning in to this joint City of Mercer Island and Mercer Island School District briefing. Today is Thursday, March 12th. This presentation is being recorded and will be available on the city's YouTube channel. The purpose of this briefing is to provide you with an update on our operations and to share a little more of the behind the scenes information that you just can't get in a press release. I also need to tell you that just moments ago, I did hear that we have 2 suspected cases of COVID-19, but not confirmed. And I want to say that again. We have 2 suspected but not confirmed cases of COVID-19. I received this information just moments ago. If I receive any clarifying information from Public Health Seattle and King County during this briefing, I will provide you an update. Otherwise, you can anticipate a press release from the City of Mercer Island and King County Public Health sometime today with more information. At the end of our presentation today, we are also anticipating answering questions that the community submitted yesterday and today, and we will do our best to get through as many of them as possible. We are likely to do additional briefings, and we will notify you in advance. It is now my pleasure to introduce Mayor Benson Wong, and he will provide a few remarks.
Thank you, Jessi. First, I want to thank our community for being understanding and supportive given the region's current health crisis. On behalf of the City Council, we encourage all of you to read and follow the recent directives from the Governor's Office, King County, and the different health departments. Keeping our public safe and healthy as much as possible is a key function of government. The city staff, the school district staff, and your elected officials are working together and in collaboration with our regional partners and counterparts. Cities are sharing with other cities ideas that they have adopted to meet this health crisis and its impact. We are trying to learn from each other during this unprecedented time. While no City Council meeting has been held since February 18, the entire City Council knows that you want to know what the city is doing to mitigate the impact of COVID-19 and what steps the city is taking to ensure that vital services will continue to be provided to our community. In just a few moments, City Manager Jessi Bon, along with several city leadership staff members, will provide you with a detailed operational update. But before that, I want to introduce you to the Mercer Island School District Board President, Deborah Lurie.
Thank you, Mayor Wong. On behalf of the Mercer Island School Board, I would like to express our appreciation for the patience of the Mercer Island community as we work through the daily challenges we are currently facing. The board has received regular updates regarding actions that the district is taking to maintain the health and safety of our students from Superintendent Kolaski and her leadership team. This includes ongoing efforts to support our students, families, and entire community now that our schools are temporarily closed. Their team is working around the clock to ensure that our students' needs are addressed. This includes ongoing efforts to support our students and families. The board has full confidence in the actions Superintendent Kolaski is taking. We welcome comments and suggestions as we move forward. This is an unprecedented time, and we are grateful for your support and appreciate your grace as we take steps to support our students. Please be reassured that your children, our students, are the priority. The school board is meeting tonight at 5 p.m. and it will be broadcast live on MITV 21, and we will be addressing many of your concerns that are being raised in much more detail. At this point, I would like to introduce Superintendent Donna Kolaski.
Thank you, Deborah. Today, just an hour ago, Governor Inslee announced a mandatory K-12 closures for King, Pierce, and Snohomish County in order to flatten the spread of COVID-19. These mandatory closures are through April 24th. We are committed to working closely with the Office of Superintendent of Public Instruction, our surrounding school districts, as well as our staff associations during this crisis time. We are closing starting tomorrow, Friday, March 13th. As a district, we are committed to providing updated and accurate information to our families that is going to be consistent and regular during this time of closure. We will also continue to support our students' learning through resources that will be shared to our families by our usual online communication tools in order to provide a continuity of services during this closure. At this time, I would like to invite Assistant Superintendent of Teaching and Learning, Fred Rundle, to talk about what teaching and will look like during this closure.
Thank you, Superintendent Kowalski. During the closure, we encourage our families to continue to abide by the guidelines provided by our public health officials, including social distancing and other measures to slow the spread of COVID-19. Closing the schools for this lengthy period of time is in the best interest of the students, the staff, and the entire Mercer Island community. While students may not be most at risk, they can be carriers who can infect those who are. We will be paying particular attention to our MIHS seniors and their graduation later this spring. Mandatory statewide testing has been suspended for this spring. And in addition to the high-quality education that we offer each day, the school district will also be providing critical resources to the families, such as childcare and nutrition. We are working with our childcare providers to continue offering a place for our students during the day while parents may be working, especially those who are providing critical health care throughout the Puget Sound region. Additionally, through our Nutrition Services Department, we will provide lunches to students, and more information about accessing these services will be forthcoming. Our district will continue to provide optional learning activities for students to use at home with their children. Some of these resources are ones already available, and others will be developed through April. Families will be communicated with directly about access to these materials through emails and our district website.
Thank you, Fred. MISD is committed to educating the whole child, and we realize that we cannot replicate the rich learning instructional experiences that include emphasis on the importance of social emotional learning with relationships at the heart of our schools and classrooms. But one of our most valuable assets is this amazing community and our ongoing partnership with our city in working together, especially during this time of crisis. Jessi?
Thank you very much, Donna and Fred, and I hope you will stick around. We may have a few follow-up questions for you in just a moment. For those of you that may be just joining us, again, my name is Jessi Bon. I'm the city manager of the City of Mercer Island. When this briefing began, I announced that we had 2 suspected cases, but not confirmed on Mercer Island. I want to assure you, I know there's an incredible amount of angst in getting that information out to the community. We have a team, an emergency management team here at the city that are working in tandem with Public Health Seattle and King County to confirm that information, and we will release it as soon as we can. In the meantime, I am going to proceed with the briefing as planned, as we have some operation updates to provide you. So let me begin. First of all, very important to remind you of Mercer Island's top priorities. That includes and will continue to be maintaining essential functions. So these are things like continuity of police and fire operations, ensuring that our roads are open and safe, maintaining our utilities and the associated utilities infrastructure, and ensuring that the city has the resources to support these essential functions in anticipation of a prolonged event. And I want to tell you that in planning for worst case scenarios, the region has informed us that we need to be looking 8, 16 weeks out and possibly even further. And that is how we are preparing to support you, Mercer Island. A quick recap of actions and decisions we've taken thus far. A reminder, February 29th, King County Public Health announced the first case of COVID-19 in the United States. It was right next door in Kirkland. 2 additional cases followed, and then several more. Governor Inslee declared a state of emergency. On March 2nd, which was the Monday following that Saturday announcement, the city leadership team convened and began implementing what we call the city's continuity of operations plans. This is how we ensure that we can continue delivering essential functions and maintaining them, as I mentioned earlier, over a long period of time. We are looking at things like supply levels, building operations. We are also certainly concerned about staff and community safety. We are educating staff on new procedures and implementing them immediately, and things are changing. This is a very dynamic situation. We have enhanced our communications. We have a website that is active, and we are pushing information out on social media as it arrives. And we are working with everybody, local, regional, federal partners, and more. Our local community, the school district, certainly, preschools, you name it, we are in touch with them. Also on March 2nd, King County declared an emergency. March 3rd to 4th, you may recall that we announced a closure of the thrift shop for a suspected but not confirmed case of COVID-19. And what I want to tell you about that situation is that was a staff reported case. It was the spouse of an employee, and they were not eligible to be tested. So we closed the thrift shop, we followed CDC cleaning procedures, and we reopened it the next day. On March 4th, we announced the cancellation of several public meetings, and as you know, we canceled several more weeks after that. March 5th, we declared an emergency, and I want to tell you what that meant and what it allows us to do. It allows us to act quickly and streamline processes so that we can secure supplies, equipment, and contracts for services. And this is really important to understand because without this emergency in place, we have to follow what can be very complicated and time-consuming bidding processes. And so immediately after the emergency was declared, we were able to procure a contract to have our buildings deep cleaned. So that was one of the immediate actions we took after the emergency was declared. We also activated our emergency operations center, and it's at level 3, which means we're monitoring the situation. We have staff working in the EOC regularly, including our emergency manager, Jennifer Franklin. This is very important. It provides the structure that allows the city to operate in an emergency and also provides very important communications structure. March 5th and 6th, we closed the Luther Burbank Administrative Building. This is where Youth and Family Services works out of and provides counseling services. This is also where the Parks and Recreation Administration is housed. Similar to the thrift shop case, we had a suspected but not confirmed case. This was also reported by an employee. They were not eligible to be tested, so we took precautions. We closed and cleaned the building. On March 6th, the city announced cancellation of all public meetings through March 20th. I will let you know that is likely to be extended. We have not announced that yet, but is certainly given the directives of King County yesterday, we are certainly going in that direction. Staff are working right now on strategies to allow for remote meetings. And this is very important because we don't want to deploy a strategy until we're sure it works and meets the needs of our varying boards and commissions, and certainly the city council and the community as well. On March 9th, this last Monday, we made the decision to cancel all recreation programs and events through April 12th. Although given the news that of 2 o'clock today from the governor, we are likely to extend that and align with the school closure. So we will be announcing that shortly. We also closed the community center to the public. And I want to talk a little bit about the decision-making there. While many of our programs were serving youth, we had a daytime population that was largely over the age of 60. We also had to maintain the community center and the operations under this COVID-19 scenario. We were cleaning constantly. My concern with that is we have to carefully monitor our supply levels and make sure that our disinfectants, our sanitizing supplies, things like gloves, are available for critical functions like police and fire. We could not sustain the cleaning demand at the community center, and that was also part of the reason that we decided to close that facility. Many staff also began telecommuting on Monday. This is not only for the community's health, but it's important that we have staff working from home in the case that we have a team get sick. That way we have a fresh team to come in and continue operating the city. I'm really proud of the mobilization of the staff teams. We relied on our IT department to mobilize extra laptops, expand our VPN capacity, and the departments to really work together to figure out how this would work. You can still call City Hall or the numbers that you would. Your phone call will go to an employee that is working remotely. March 10th, we made the decision, and this was a difficult one in particular, to close the Luther Burbank Administrative Building to the public. Again, this is where our Youth and Family Services counselors operate from, and they have transitioned to a telecounseling program. In just a minute, I'll be inviting Cindy Goodwin, our Director of Youth and Family Services, to come up and give us a report on operations. On March 11th, just yesterday, Governor Inslee announced a 3-county ban on events that are greater than 250 people in size. As a city, we had already canceled all of the events that met that criteria. Public Health Seattle and King County, also issued an order prohibiting events with fewer than 250 people unless appropriate steps were taken. And I will not go over those steps here, but I will note that once that order came out, the handful of private rentals we were planning to host at the community center, most of those have now also been canceled. We are modifying our thrift shop hours, and again, I'll have Cindy Goodwin update you on that. And of course, yesterday, the school district announced a closure beginning tomorrow. Today, we have not issued the press release yet, but I am announcing the closure of City Hall to the public, and we will likely extend that closure to align with the date of the school closure. This again is to ensure the safety of the staff, and I will remind you that while we have a number of staff telecommuting, we do need to maintain a core team here to continue providing services. And it was just getting too challenging and concerning to keep City Hall open to the public. Operational changes. It's important, Mercer Island community, I tell you that we are prepared. We are adapting daily. This is a dynamic situation, as I've already mentioned. We are utilizing team members creatively to address emerging needs. So as the community center closed, we redeployed a number of those staff to support the city in other ways. We are stewarding resources thoughtfully. It is certainly top of mind that we are losing revenue with the community center being closed. I have concerns about the thrift shop and our ability to sustain that operation, which is where we get critical funding to support YFS and other costs as well. I want to thank the staff. Every day they have showed up for work. There has been something new, a change, an adaptation, a new rule. They have demonstrated incredible commitment to their service and to the Mercer Island community. Thank you. Also, to the community, your emails are being read and received. You have been so thoughtful in reaching out and asking how you can help, and we will come back to that in just a moment. Thank you. Communications, important to note that we are continuing to communicate with local organizations. We are working with the Chamber of Commerce on ways to support small businesses. We understand that there are a number of resources becoming available from the state and the county and other partners to support local businesses. We will be doing everything we can to get that information out to you. I will also encourage you, Mercer Island community, to shop local. I was in Town Center last night, and there are signs up everywhere that says, you know, dine out, we'll call in your order, we'll provide your food curbside. I certainly saw some wonderful promotions today from Island Books about ordering online. So let's get together. That's something that you can do. A critical action item is support your businesses, not only in the Town Center, but also on the south end. We will continue to update the city's website and push out social media updates. as quickly as we can. And as I mentioned at the beginning, we will be scheduling additional live briefings as this event unfolds. At this time, I would like to invite Fire Chief Steve Heitman up to give us an update on fire department operations.
Good afternoon. My name is Steve Heitman. I'm the Fire Chief for the Mercer Island Fire Department. I just want to let you know first off that Mercer Island Fire Department is at full staffing at this point. We do not have any personnel who are off related to COVID-19. I'm going to first start with talking about what Mercer Island Fire Department is doing during this crisis. One of the first things that we've implemented is a wellness check every day for the crews that are coming into the department. We have them check their temperature at the door as they're entering the building. If anyone has a temperature that is 100.4 or higher, they're immediately sent home on paid administrative leave, and they won't be returning to the department until they have been without symptoms, especially of a fever, for at least 72 hours without the use of any type of antipyretic, Tylenol, ibuprofen, those sorts of things. We've been updating dispatch criteria that alert crews to the possibility of COVID-19 on some of the calls that we go on, which then helps us determine our level of what we call PPE, or personal protective equipment. That consists of a mask, eyewear, gloves, or gowns. Despite the fact that we've updated this criteria, and despite the fact that the dispatchers do a great job of asking questions, we still have had a number of departments that have had close calls where they responded to a chest pain or a fall patient, only to go in and find out that it's secondary to COVID-19 symptoms. And so now the crews are exposed, and a lot of them are going into quarantine. So to avoid that, we are sending a first-in scout, and that means the rest of the crew is going to remain at the door while the first person in has a minimum of eye protection, a mask, and gloves on, and asks a few questions such as, have you experienced flu-like symptoms? Have you had a temperature recently? Have you been around anyone who is sick, or have you traveled? And there are a number of other things along with that. Once we find that out, if they answer affirmative to any of these questions, the entire crew is going into full PPE, which means putting on the gown as well. We have found that this is not transmitted through aerosol, which is good news. It's more through droplet transmission. And so that level of PPE, if our crews go and see a patient who then tests positive for COVID-19, it's not considered an exposure. We're stocking up on personal protective equipment and using it on a majority of our aid calls. So if you happen to see our crews going into some type of facility or someone's home and they're all wearing full protective equipment, it does not mean that someone has COVID-19. It means that we are protecting the firefighters, because we cannot afford to have to send them off to quarantine for 14 days just to see if they get symptoms. We've been reviewing the training and use of our PPE, because believe it or not, as much as we use it, it's always good to practice with that. And we are definitely wearing full PPE into all care facilities, since those are the areas where we have seen this spring up the most. We're providing daily updates from the various meetings and conference calls. Every day, I am on a conference call at 3 o'clock with the Department of Health, King County EMS, Dr. Tom Ray, who's the King County EMS Director, Dr. Michael Sayer from Seattle, all the fire chiefs and all of their health officers from the county. And so we're discussing what it is we're facing, what we're going through, what supplies we need. We're developing policies. So it's a lot of good information. We're definitely involved with that. We've set up our aid cars. We've separated the transport compartment where the patient is from the driver's compartment with plastic, and they have 2 separate ventilation systems. Again, just to protect personnel as they're driving. We don't want to have our drivers heading down the road having to wear their full PPE and possibly transmitting something inside the aid car. We're sharing information both inside the organization and outside the organization on a constant basis. Our records management system that we use to track patients for every call that we go on now has specific tabs for COVID-19. And the reason for this is King County EMS is monitoring every single call we go on. We're providing the information within those tabs of who was on the call, what PPE was used, and the signs and symptoms are looked at, and that's how they're identifying the patients. They're also going back through our records. As was stated earlier, we suspect that this might be or might have been here for months. And so people may have already been sick and not even known it. And so they're using that information from our records management system to identify potential candidates for that and following up. It's fire stations. We've locked our lobby doors. This is to keep the public out. It allows our firefighters, when you ring the bell, we still encourage you to come by the station, even if you just want a blood pressure check, but it allows our firefighters to question you through a door to find out the reason you were there, find out if you have any symptoms. If you do, they'll throw on their protective equipment and open the doors, and we'll still treat you. If you have not had any of the symptoms, then you'll come in as normal and we'll take your blood pressure for you. We've also taken the steps of canceling all ride-alongs. We don't want anyone from the outside coming into the fire department. Even though we are probably the cleanest area that you're going to find, even including outside in society, we want to make sure that we don't have that chance of cross-contamination. We're also suspending company inspections with the exception of high hazard occupancies. So what do we know about COVID-19? We know that it has a high morbidity rate, which means that it's highly contagious. At this point, it has a high mortality rate because the majority of the patients have been in care facilities. They're older and they tend to be immunocompromised. And so, yes, this has a high impact on them. As of yesterday, it was found that there were 10 care facilities within the county that had confirmed COVID-19 cases. As I said earlier, the CDC states that the primary transmission is via droplets, so someone coughing, if they have a productive cough or any other means of sharing even a straw, you can catch that, but it is not an aerosol form. Symptoms occur on an average within 14 days of exposure, but there have been the variations as usual. Some people get it within a few days. One case that I heard of it was 27 days later. Department of Health is looking back through our records, as I said, to determine how long this has been around. There have been a number of fire departments in the area that have been affected. There are a large number of firefighters that are currently in quarantine due to this. But again, as long as we're practicing with our protective equipment, it is not considered an exposure. And fortunately, we were able to get a shipment in today so that we are well stocked with all of our protective gear, which includes the masks for the firefighters, which is an N95 that I'm sure you've seen out in the media. Also surgical masks, because as we put what we call a non-rebreather mask on a patient that supplies high flow oxygen, we need to put a surgical mask over them because as they breathe out, they can send out the virus. First responders have been moved to a Tier 1 priority status for receiving PPE. This is something that was unbeknownst to us. The hospitals and care facilities were on the top tier and first responders were not on that. So we've since had that changed at the state level so that we're a priority for receiving that equipment as well. And like I said, today we received our first PPE that came in on an entire pallet, which was a great thing to see because I was a little bit worried. One thing we did not have was HEPA filters for our bag valve masks, but fortunately Bellevue and Eastside Fire both gave us masks out of their stock, and a lot of the departments have been cooperating that way and supplying those types of needs. So what can you do as a public? Make sure you go to the public health website for all of your information. That is where it's updated the soonest, that is where it is the most accurate, and there's a lot of great information on there. If you do have symptoms like a cough or a fever or other respiratory problems, call your healthcare provider. Do not go to the emergency room. Emergency rooms need to be able to serve those with the most critical needs. One of the biggest issues we could face with this is if our hospital system is overwhelmed, there is a potential for collapse. We don't want that to happen. But if you do have a serious injury or illness, definitely call 911. We'll still be there to take care of you. We'll still get you to the hospital. Avoid close contact with people who are sick. Avoid crowds. Wash your hands often. Make sure you have several weeks of medication. If you can get your prescriptions filled a little bit early, now would be a good time to do so. And then clean and disinfect high touch point areas, your doorknobs, flat surfaces that you touch a lot, the refrigerator door, anything, especially if you have kids, anything that's touched a lot, the television, the remote, cell phones. Make sure you're disinfecting these and keep yourself as healthy as possible. And lastly, we received some questions from the citizens, and so I'm going to provide some of those answers now. How many on Mercer Island have been tested? I don't know. I am not given the information, especially if they went through their primary healthcare provider. We do not get that. We only get confirmed results so that in case we transported. What is the process to get tested? First off, call your primary healthcare provider. They can set you up to be tested if you suspect that you have it, or they'll make a recommendation that you get transported to the ER. Also, they want to know, how is it done? It's as easy as a cheek swab, and so it does not take long. How long is the turnaround to get actual results? Unfortunately, it's been variable. I've heard up to 13 days in some cases, and they're trying to take care of that. Problem is, we only have a couple of labs that can do that. Fortunately, the University of Washington is standing up a lab that, when it is fully running, will be able to test up to 1,000 cases a day. It's a drive-through lab, so that literally you make an appointment, you drive up in your car, they swab your cheek, you drive away. It will be that simple. Do the results still have to be confirmed by the CDC? The results are confirmed by the testing lab, and the data from those results is gathered by the CDC and the Department of Health. Will any that test positive be quarantined? And that is the current recommendation by public health. Most quarantine is going on. They're recommending stay in your home. Even if you have family, unless you have somebody who's immunocompromised, they're recommending just staying home, isolating yourself, and using the hygiene methods that we talked about. What is holding up the widespread testing? It's a shortage of test kits and a lack of proper testing facilities. As I said, there's only 2 labs available right now. This will be changing, though, once the University of Washington gets up to speed. And finally, what's the most up-to-date recommendation for wearing a mask going forward? I'm assuming this means from the public. That is a personal choice. What we have talked about in the conference call is that a mask out in public really is not that effective, because again, this is by droplet. So if you are going to catch this out in the public, more than likely it's going to be because you touched something and then you touched your face or your mouth or your eyes. And again, if it's a comfort thing, the choice is yours. One thing I would caution, though, is trying to buy up a bunch of surgical masks because A, they're in short supply, and your hospitals and your first responders need those. Remember, this is a very dynamic situation. This information is changing daily. We've had a number of things that we've tried to do during this, and the next day they change the protocols that we're utilizing. So if you are out in the public and you see us doing something a little bit different, it's okay. It's because the protocol has changed. Thank you.
Chief Heitman, before you step away, I wanted to invite the panel that's here to ask any follow-up questions.
Okay.
Does anyone have a follow-up question? They do not.
Thank you.
All right. Thank you very much. I am now pleased to introduce Police Chief Ed Holmes.
Well, good afternoon. As Jessi mentioned, I'm Ed Holmes, your police chief. I have been with the department for almost 26 years and about 14 as your police chief. So in my role as the police chief, I take the safety of the island particularly seriously. And so when we face issues like we're facing with this virus, the safety of the island weighs heavily on my soul. So what I think about a lot is keeping our officers healthy. What do we need to do to keep the officers healthy so they can respond to the emergency calls that we get? So I thought I would just highlight, I think we got 6 areas. I want to spend a few minutes on each. And really it starts with personal hygiene. So we have hand sanitizer stations throughout the police department and in the patrol cars. There's disinfectant wipes. And as Jessi had mentioned, we have a cleaning company helping with some of that. And I've also been really clear with the officers, if they feel sick or even if they start to feel sick, to not come into work. When we talk about actually going out on calls, so we use a regional dispatch center called NORCOM. NORCOM screens for symptoms when callers call in, and then the dispatchers can advise the officers what they learned when they screen the calls. Personal protective equipment, you heard the fire chief talk about that. Each officer is given personal protective equipment. It includes glasses, gowns, gloves, and a mask. So we have that for all the officers. And anytime they are going to a facility where there's a higher risk, or if the dispatch has advised them that someone is sick and they have to make the contact, they can wear their PPE. Next, we are changing some protocols in how we operate, aimed particularly at reducing the number of in-person contacts. For example, we are, to the extent we can, we're taking reports over the phone now. So if and when practical, we'll take a police report over the phone versus in person. We have suspended our fingerprinting service and our car seat checks. We've suspended that for a while. We've also canceled our discretionary training. So police officers, we receive a lot of training, and the non-mandatory training has been suspended for the time being. We have also moved the non-patrol officers to modified work schedules. That includes telecommuting. And again, it's an effort to reduce in-person contact with each other. If needed, if we have patrol officers get sick, I think it's important to let the community know we do have at least some depth. I can reassign officers who are not working patrol shifts right now. They can be moved and reassigned, for example, from detectives to patrol. So if we need to do that, we have some capacity to do that. And as this situation continues to unfold, we seem to learn new information almost every day. We will remain adaptable and flexible and change our protocols as we need. I know the whole city is working together to try to ensure continuity of service. There's a lot of really good information on the city's website, and particularly the emergency management tab. It has a lot of good information on this COVID-19 virus. There's been some questions I've heard about elderly population, vulnerable population. What should we do with that? What can we do about that? And there's, again, a lot of really good information on the website. Officer Franklin, our emergency manager, has done a really good job of just uploading a lot of good information there. So I'd say, despite all the uncertainties we hear, I think it's also important that the community knows that the fire chief and I have been in close contact, working really closely together, and he and I feel reasonably good that we have a pretty good plan in place to try to keep public safety service where it needs to be for the island. So that's what we're doing with the police for right now. Any questions from the panel? Mayor.
Chief, actually, this could also go to Chief Heitman as well, but so you talked about having a limited bench, I guess, as far as potential. I mean, if we happen to have some officers who contract COVID-19, at some point in time, if that bench is used up, I mean, is there talk among the region, among different cities about how to backstop all that? I mean, that's under the worst case scenario.
Yeah.
I grant you that.
Well, I guess I'll answer like this. Those discussions are starting to happen. The other thing I'll say is we are blessed in this area to have really wonderful relationships with our surrounding agencies. That's not always the case in different parts of the country, but certainly in this part of the country, we are all the chiefs and the sheriff, we're all what I call professional friends. I mean, we really do help each other out whenever we can. So I know I have regional partners I can lean on. I don't know what their availability would be, but those discussions are starting for sure. So thank you.
Chief, can you talk about your shift and the protocols, and the protocols we implemented just this week to make sure that even the management team isn't all in the same place on the same day?
Yeah, that goes with the modified schedule piece. So we have, myself included, we've moved to some telecommuting days. We're trying to make sure we always have at least one detective here, someone from command staff. Jennifer's alternating with one of us when she's not here on those days. And again, the records clerks are going to be telecommuting and a few others. And it really is designed to reduce the amount of close interaction we have with each other while still being able to provide service via phone or via the laptop at home.
Any more questions for Chief Heitman at the moment? Excuse me, Chief Holmes. All right, it's my pleasure to introduce Cindy Goodwin, the Director of Youth and Family Services.
Good afternoon, everybody. Cindy Goodwin, Director for the Department of Youth and Family Services. We've gone over a lot of the health concerns, so we're doing the same thing there, and I'm really happy to see people doing that as well. Our goal with Youth and Family Services is to continue providing mental health services and make sure that we can continue to provide basic needs to our most vulnerable people. And when we're thinking about that, we're thinking about our senior citizens, and we're thinking about our low-income people who might not have access to food and other types of basic necessities. So we are providing all services in a modified fashion. So right now, as Jessi alluded to, we have no public entry to Luther Burbank building. We have no face-to-face services, but we are continuing therapy there. We have therapy by phone. We are doing the therapy that we do with kids outside of the office. There's certain modes that you do to have contact with kids and to keep them moving and take them outside, and they are continuing to do that. And then we're looking at video therapy. Actually, a lot of the organizations in this area are going to this, and we are getting our computers compatible and getting our paperwork HIPAA compliant, and we are looking at beginning that on March 30th. So that's in the works. For the food pantry and emergency assistance, we still have case management services as anybody can call in. We'll continue to hook them up with resources outside of our area. We will continue to provide food for people. We're meeting people at the door with groceries of pre-bagged groceries and gift cards so that we can keep out the same level of food to the community that we always have. And we provide about 1,500 visits to the food pantry a year. So a lot of doorbells are going off, and we're making sure that everybody gets their food. For people who need rental assistance, utility assistance, and temporary financial assistance, and we've gotten some calls already from people that know that hourly workers in particular, are going to need more help. And so we are making sure that people can continue to access that and that we can think about how do we provide that in the long term. So that's continuing to happen. Our senior services, our geriatric specialist is still on, she is at the building, she's working with the phone, she's checking in with vulnerable seniors that we see, and we're making sure that those seniors that need any kind of food and other services are having that happen. For some seniors, we were trying to stay on top of needs. We're trying to follow with calls that come to us. Right now, we have not seen a high need for seniors needing somebody to go to the home, but we'll stay on top of that. We've gotten a couple of calls about that, but we're making sure that they know how to order in food and that they have resources available to them for that. Our school-based mental health counselors, starting tomorrow, will still be providing services. They are going to work, at this time they will be in their offices at the school, and they will provide assistance to the kids that they're worried about in their school, that they have contacts with, and they'll still be serving families. They'll do this there, and if there's any change to that, we'll keep that updated on our website for parents to find out where they can meet with them, and keep it up through social media. Their configuration of services is bound to change. So as we get further along into this, and as we know more about what those families need or what those youth might need, we'll get that out, the information about that out as well. The thrift shop. The thrift shop is open daily. We clean all services in high frequent areas regularly, but we are going around the store on an hourly basis and cash register and other high touch areas more frequently. And our goal really is to keep this store open, keep it open and keep it healthy. We have hand sanitizer by the door, and we also have something posted asking people if they have symptoms, would they please not frequent the store. And our goal for keeping the store open is that it's our major revenue source, and we'd like to be here and be able to continue funding the services that are so important for people. I have some resources here. Our intake line is still open. We will call people back within 24 hours. We will keep all of our services updated through the Facebook of Youth and Family Services, the YFS page on the city's website, and then if anybody is concerned about a neighbor or they see a need and they just have a question, they have a suggestion, please give it to us. Let us vet that. We're getting a lot of great ideas. Some we can't do, some we can't entertain, but some we're looking into. So thank you. We'll consider them all. I just want to say there's a couple of resources out there. We've heard that some parents are going to make additional Facebook pages like other communities have that have parent and youth survival tips during this time when they go out of school. So we will also work with any community group trying to get resources out there for their fellow community members so that we can all be talking and communicating. And I think so both chiefs have alluded to this is a constantly changing situation. So if you have any ideas on how we can work with people or something that you might see in your community, keep speaking with us. We need to hear them, we need to vet them, and just know that our first concern is making sure that we're here for everyone, and that our kids that are high needs, our children who might be in crisis right now, that we're staying with them, that families know that we're staying with them, and that we're here. So give out our number and follow our website and we'll be here with you through it.
Any questions for Cindy?
Perhaps not a question, but a comment. We have also been notified by families setting up Facebook connections, and we hope that they are not organizing, again, large groups of students. We want everyone to maintain the social distancing as it's been recommended, certainly by public health. So we did have a couple of little red flags go up when we were seeing some of that on social media as well. Let's bring all our kids together, even for play dates. I really caution against that. The intent of the closure is to keep everyone safe and maintain that flattening of the virus, particularly through the social distancing. So thanks for bringing that up.
Yep, we'll be with you on that page.
Cindy, I have a question. As far as the school-based counselors, do you see any staffing changes? Or, I mean, you're going to keep the same staffing levels. It sounds like it. And so, in terms of job duties, and is that going to change?
Yeah. So first of all, everybody will be used in capacities that are needed. And if we need them at the thrift shop, they might go to the thrift shop. For right now, because we're at the point where we can keep them where we are, they know the families in their school. They know kids who have suicidal ideation. They know kids who are dealing with severe anxiety. They know kids that will need regular check-ins. They also have relationships with parents who will need help getting through this extended period without any kind of structure. So we want to keep them where they are for right now. And if we need to, and as our staff becomes constricted or shifted, we have phones that we can give that information out on, and we also have websites. So we will try to stay in constant contact with people so they will know how to get in touch with their counselor or how our staff is being reassigned. But we really, I think like many departments, one thing that we're doing, and I think this is really worth mentioning, so at the Luther Burbank offices, they're not open. They're also being divided into two, where there's a back door and a front door, and doors will be closed and taped off so that you will not have any kind of sharing of anything, so that we can have one team be A, one be B, and let's say one team is infected, they leave, we continue to function, and those teams are divided by certain amounts of clinicians, clinical supervisors, people who can do administrative processes for all the emergency assistance that we need. So we're trying to divide people up and make sure that our staff can go on as long as we possibly can. But I think we're all working with the assumption that if our workload goes down, and it's bound to, it's going to even out somewhere, that we can be reassigned. And so we're working closely with City Hall and other buildings that need us, just like anybody else's. Yeah.
Cindy, I'm probably jumping ahead a little bit of an announcement that will likely come out tomorrow, but we've been asked, we're no longer accepting food donations. Became too much for us to administer safely, but we are accepting food gift cards. Can you talk a little bit more about how people can help with that?
Yeah, thank you. We are giving food cards out in the denominations of $25 and $50, depending upon the size of the family and number of bags. And if we'll be doing that probably for the length of this situation, and people can donate them by dropping them off at the thrift shop, the Luther Burbank offices, and we'll also have a drop-off here, and that's going out on social media today or tomorrow. And we will be requesting that throughout the situation. We also had a group today ask if they could do National Charity League, I believe it is, if they could do a drive in front of QFC for food cards. So we, of course, accepted, and we would love to work with them on that. So we're hoping that we can partner with other groups in ways that are safe with social distancing and which help us out and them out too. So.
Any other questions for Cindy? All right, don't go too far because I think Deb has a list of questions as well. All right, just to wrap up our presentation, and then we will have a quick Q&A. Just a reminder, you've seen this information probably 1,000 times in the last 2 weeks. Really, I implore everyone to help us slow the spread by using good hygiene practices and encouraging, also, I have young children, teaching them about how to use good hygiene practices. And I will put up here on the screen additional resources. I should have said this at the beginning. Public Health Seattle and King County has jurisdiction over this emergency, which means that as a city, we are working with them and taking direction from them. Certainly, it is my job as your city manager to make operational decisions for the city, but anything that's specifically related to health matters, we do coordinate directly with Public Health Seattle and King County. In closing my presentation today, I just want to mention that there's one thing I know for sure, and it's that this community, Mercer Island, will come together, is coming together, and we will get through this. We are not able to deploy volunteers in a way that we would normally do because of the nature of this health emergency. So we are relying on you, Mercer Island, to safely check on your neighbors, which means keeping a safe distance, and reaching out to Youth and Family Services if we can be of assistance to anyone in need. Also, very important, please make sure your family has what you need in this emergency. We have toolkits and information on our website about emergency planning. And we as a city will continue to focus on our top priority, which is ensuring that we can provide essential functions to the community. As a parent, I have 3 kids, age 5 and under. I fully understand the impact of the school closure. We will be working with all of our partners on to support you in that situation. I'm also a daughter. I have a living grandmother still. I understand the anxiety of caring for elderly family members and friends. And I also understand, as a person that really cherishes this community, the fear we have for our economy and our local businesses. I just want to acknowledge that those concerns and fears are real, and I believe that if we continue to work together, we, again, will be able to get through this and manage through this. The city is prepared, and I need to say that the city is absolutely prepared. We've been working hard in anticipation of something like this happening, but over the last 10 to 12 days, we have had the gas pedal down. Every single staff person is working on the response. Our essential functions will continue. So at this point, I would like to ask Deb Estrada, we have just a few minutes left. I know you have a list of questions that were submitted. I think several of them were for the school district. Would you like to go ahead and read those questions, and we'll see if we can get answers?
Thank you, City Manager Bon. Again, Deborah Estrada, your city clerk. Of all the questions that were asked and answered earlier, there's just 2 remaining questions that we have from the community. The first one is, how will parents communicate with teachers if needed?
So first off, before I answer that, I would like to invite, as our President Lurie mentioned, we do have our regularly scheduled board meeting tonight where we will be having a discussion regarding next steps for our families based on the school closure. So I would encourage families to watch. It is broadcasted live. It will also be then, of course, posted on our website. So communication will be in, really frankly, the usual manners that we use for communication. Email. All of our teachers do have email that they will be able to access even with the schools being closed. So that's one of the major ways to communicate.
Thank you. A second question for the school district. What about if my kids want to play with their friends?
So one of the problems that does occur, and one of the concerns that's considered very seriously when a decision to close school is made, particularly in light of helping to curb spread of a virus, is we know particularly our adolescents, their peers are really, really important to them, and they want to spend time together. Students might not say that they don't want to have school, but they really do miss their peers. But during this time, we really need to be cognizant of the social distancing and having our students not be together in large groups. I caution parents of, I've heard a story of a district that closed much earlier where fairly large groups of teenagers are gathering in the basement of a home. I strongly discourage that. I know it's difficult, parents, but please really abide by the social distancing and be very careful about allowing our students to pass this virus from one to another and potentially eventually to a place where it really can be critical.
Mayor Wong, you had a question?
Actually, if I can just make a comment. I know time is running, and I just wanted to say again that we're in this together. I mean, this is a problem that affects the island, it affects the region, the nation, and sadly the world. So we have to work together to try to address this. But I also want to bring this back down to our community, and I really hope that you can sense we have a lot of dedicated public servants, and I think I'm very proud of the city staff, and I'm sure I speak on behalf of the entire city council. We have seen you folks work very hard. You haven't let up in the past 3 weeks, 4 weeks, whatever it is. So I just want to say that we're very much appreciative, and I hope that when the community, when you see some of these folks out in the streets, that you would thank them as well. And again, really appreciate all the hard work. We have a long way to go, so keep the foot on the pedal. So.
Absolutely. Thank you, Mayor Wong. I will conclude with where I started, which is just prior to walking into this briefing, we received news that we have potentially 2 suspected but not confirmed yet cases of COVID-19 on Mercer Island. I have been checking my cell phone as I've been sitting here, and I do not have an update yet. I will be leaving this briefing and immediately going to work with the emergency management team and Public Health King County to get a better understanding of the information we have. If we have news to share, including an update on these 2 cases, we will push that out immediately. I do understand Mercer Island community. It is frustrating that it takes time to work through these issues. We take this very seriously, and we will get the communication and information out to you as soon as we possibly can. And I want to emphasize 2 cases, suspected but not confirmed yet, and we will be working on that immediately. Thank you to Mayor Wong, Board President Lurie, Superintendent Koloski for joining us today for this briefing. And we will make a time or identify another opportunity for the next briefing. And thank you as well to the staff for joining us today. Have a good afternoon.